Good evening. It's our pleasure to have our next expert, Dr. Sarita Gulati, Senior Interventional Cardiologist from Manipal Hospital, Dwarka, New Delhi. Welcome you, ma'am, to WCC 2023. Just tell us briefly about your presentation that you're going to have in today's conference.
Thank you. Basically, I will be dealing with coronary artery bifurcation lesions. Actually, it is one of the complex lesions we deal while we are managing the coronary artery disease in people, and it poses a great challenge to the interventionalist because you have to make a plan according to the angiographic views and according to the IVS information, the vessel anatomy, and what is the exact plaque composition, the point you are dealing with. So the planning has to be really correct so that we can give maximum benefit to the patient without much of complications. Here my point basically is how to do with not many of stents and the least number of stents, and how to keep the patient safe and clinically better at the follow-ups also. So there I take into consideration many things. Of course, the side branch, vessel size, its angulation, what is the plaque burden, how much area it is supplying to the heart and myocardium. And my initial approach is that if you can do away with 2 stents, then it is very good. But all this has to be taken, it is the decision based. As I have already enumerated, we have to see how much ischemic myocardium we are dealing with and what is the best course for the patient in that particular situation.
Okay, so you told us that by IV intravascular ultrasound, you are able to delineate the lesion. So, are you using OCTs also for defining for the therapies for the bifurcation?
Basically, what happens is that these coronary imaging techniques are at our disposal, but with a cost, and there are few advantages of OCT, which lesion I am dealing with, whether it's an osteal lesion or not. So, these things also matter. Important is then when doing in a practical world, I have to see so many things, whether the patient can afford that much cost or not, and what added benefit that imaging technique will give to me. So many times, as your experience increases, there are many cases which you can do away without imaging also. But of course, there are cases where you need their help, and of course, once you are done with your case, whether you have achieved the optimal result, that is the point when these imaging techniques can come handy.
Okay, so tell us something about the outcome data of the bifurcation with the 2 stents, and that you were telling us any outcome data that you can like any prognostic factors pre PCI.
Once we compare 2 stent strategy with provisional bifurcation stenting or a 1 stent strategy, the many factors which come into play about the success is what is the operator's experience,
right,
and what technique he is using. If we have achieved good results in both the vessels, and there is minimal there is complete stent overexpansion, all the stent studs have been opened properly, then we expect a good result. So it is much operator dependent also, and which technique one is very conversant with. The end result will depend what is the excellence of the result you have given to the patient.
Okay, right. And last but not the least, your message on the occasion of International Women's Day to all the female clinicians across the nation.
For the female clinicians, I always congratulate them for their efforts, for their multitasking, and they are day night, day out, they are proving themselves in the world. For my patients, I always want to tell them that your health is as important as your family's health. You can better serve your family if you yourself are healthy. So please take care of yourselves so that you can do good to the society at large.
Yeah, that's so important, because if a female is healthy, then only she can take the
Yeah.
care of the society also, as well as
Family
family
also,
also. Thank you so much, ma'am.